Welcome to Hey Dr. Sue. So people submit their sex questions to me anonymously, and once a week I post one question and one answer. Do you have a sex question you've always wanted answered? Go ahead and check out the description for information on how to submit it anonymously. This week's question is, how safe is the birth control shot? So it kind of depends on how you define safe. I'm going to assume that you're in the US, in which case the shot you're referring to is Depo-Provera. There are other options in different countries. Depo is a shot that's given by a healthcare professional every 3 months. The shot is intramuscular, and so they're going to give it in either the butt or the upper arm. There's also an at-home injection. It's called Depo Sub-Q. This is also done every 13 weeks. This one is under the skin, and you would give yourself the shot in either the stomach or the upper thigh. This version has fewer hormones than the regular Depo shot. In terms of effectiveness, Depo's pretty effective. In perfect situations, it's more than 99% effective. But when you take into account human error, the effectiveness does drop, and it drops to about 96%. This is less effective than other hormonal methods like the implant and hormonal IUDs, but it's better than pills, patches, and rings. It's also way better than external and internal condoms. Depo doesn't contain estrogen, so for people who don't like using estrogen or can't use it, this may be a good option. Like all hormonal methods, the shot is 0% effective at protecting against STIs. I want to mention a few things about Depo. They're not safety issues, but I think they're important to mention. Weight gain is definitely a thing for people who use Depo. The average is around 5 pounds of weight gain for the first year, and then even more weight the second year. Also, some people have bleeding issues with this. Some people may actually stop getting their periods altogether, which they may see as a very positive side effect. But for other people, it may cause really irregular bleeding. The last thing I want to mention is how soon you can get pregnant once you stop using it. Usually when you stop using a hormonal method, you have a pretty quick return to fertility, but not with Depo. With the shot, it's usually a longer return to fertility. We usually say it can take up to 10 months, though this will be different for every person, so don't count on it taking 10 months. Now, on to the safety issue. People who use Depo report a wide variety of side effects. This is common for any hormonal method of contraception, but there is a major health concern we see with Depo that we don't see with other methods. It is not recommended that you use Depo for more than 2 years because of its link to the decrease in bone density. At this time, we don't know for sure if that decrease is reversible or not. There's a bit of research on this, but the research is a bit contradictory. It's worth it to point out that the US has the highest maternal mortality rate in the industrialized world. So when thinking about safety issues, you have to think about how the risks associated with any form of hormonal contraception compare to the risk of getting pregnant and giving birth in the US. Until next time, be safe and have fun. Did you like that video? If so, make sure to like and subscribe to the channel. That way you'll know when new videos come out. Also check out the description to find out how to find me on Instagram, Medium, and Twitter. And make sure to check the description for links where you can submit your sex question.